Hi, I am Priscilla, and in this video, we will cover trauma-informed care for caregivers of children. Whether you are a parent, grandparent, foster parent, or other primary caregiver, it is a struggle to care for your child who might have faced some form of trauma. I hope that this video will provide useful information and help in understanding the struggles of children who have faced trauma, and as well as some tips to assist you with your child. This is Xiao, a little boy who will journey with us into this difficult but important topic. Are you ready, Xiao? We will be covering causes of trauma, clinical trauma, symptoms, how to provide care, and leave you with some resources at the end of the video. How do we understand trauma? Tara Brunch is an American psychologist and author, and she wrote that trauma is when we have encountered an out of control, frightening experience that has disconnected us from all sense of resourcefulness, safety, coping, or love. Trauma can arise from childhood abuse, neglect, witnessing violence experiences such as accidents, natural disasters, and other significant life events. It is marked by feelings of intense fear, helplessness, loss of control, and threat of annihilation. Did you know that in Canada alone, a quarter of Canadians have reported being physically abused during childhood, while another 8% reported being sexually abused in their childhood? Childhood sexual abuse are more often unreported until adulthood, compared with other types of police-reported crimes. Among those who had experienced physical and/or sexual violence as a child, 93% indicated that they had not seen or spoken to either the police or child protection services about the abuse. Minorities are at even higher risk of childhood trauma. For example, LGBT people are twice as likely as having experienced childhood sexual abuse, and Aboriginal people in Canada experience physical and sexual violence disproportionately higher when compared to other communities, with over 2 out of 5 Aboriginal person having been a victim. Successive generations of Aboriginal people have experienced childhood physical and sexual abuse that are tied to Canada's residential school system, resulting in a form of trauma called intergenerational trauma. Let us dive deeper into 3 specific types of trauma and their definitions. The most known form of trauma is individual trauma, which results from a single traumatic event or series of events that is physically or emotionally harmful or life-threatening. It also has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. Another form of trauma is complex trauma, which is often used to describe trauma that is the result of stressors that are interpersonal, usually severe and sustained. Complex trauma commonly occurs when a child suffers through repeated individual trauma. In some cases, inflicted from a parent suffering from mental illness, drugs, or alcohol misuse, or have been negligent. Lastly, intergenerational trauma is accumulative emotional and psychological wounding over the lifespan and across generations, emanating from massive group trauma. These collective traumas are inflicted by a subjugating dominant population, and this concept was initially developed in the 1980s by Aboriginal peoples here in Canada to explain the seemingly unending cycle of trauma and despair in their communities. Trauma then subsequently manifests in related disorders as provided in the DSM-5, a manual for assessment and diagnosis of mental disorders, falling under the category of trauma and stressor-related disorders. Post-traumatic stress disorder, or PTSD, is a common diagnosis for someone who experienced trauma. However, there are other disorders that would also fall under this category, such as reactive attachment disorder and disinhibited social engagement disorder. Many children who are diagnosed with reactive attachment disorder and disinhibited social engagement disorder are those who faced neglect, deprivation, lack of basic emotional comfort, stimulation, and affection from their caregivers. Reactive attachment disorder are related to grossly inadequate parenting, and the child might present with severe neglect, such as malnutrition, poor hygiene, and might even have developmental delay, especially in language and cognitive abilities. Whereas children diagnosed with disinhibited social engagement disorder would have inappropriate and over-familiar behavior with unfamiliar adults and strangers. They may also present with signs of severe neglect. Not all children and youth who experience traumatic events develop post-traumatic stress disorder, but many children who experience physical or sexual abuse or who are exposed to violence develop at least some of the symptoms, such as numbing, re-experiencing the traumatic event, or avoidance. For some children, trauma interferes with normal development and can have long-lasting impact in their lives. Trauma-exposed children can exhibit a wide range of post-trauma reactions that vary in their nature, onset, intensity, frequency, and duration. There are various factors such as their age, the child's personality, and environment factors that will affect how trauma affects each child individually. Every child responds to trauma differently, and their perception and sensitivity towards these events would also lead to varied effects on their psyche. Even infants who are too young to talk about what happened can retain lasting sensing memories of traumatic events that can affect their well-being into adulthood. With that, with that in mind, it is far more harmful for a child if they have experienced multiple types of traumatic events or suffer through the same type of trauma repeatedly. Thus, it is important to know how to recognize and properly identify the various types of trauma reactions to better provide care for your child. We shall take a look at the manifestations of PTSD in children first. Here are some signs of PTSD taken from the DSM-5. Your child might engage in play reenactment, repeating traumatic events over and over in dramatic play or conversation. They might also have distressing dreams, flashbacks, or maybe negative and socially withdrawn. Some children will exhibit angry outbursts, while PTSD can also affect their concentration in the day and their sleep at night. Here are some other signs of trauma, especially for those 5 years and under. And again, we see here there might be delays in reaching physical, language, or other milestones. When a child is between 6 to 12 years old, signs of trauma may present itself in school and social settings, such as having difficulty to pay attention in class, frequent tears or sadness, fighting with peers and adults, and getting into trouble in school and at home. Changes to school performance could be a common sign that a teacher might observe. They might also regress into a young child and engage in behavior associated with a younger child, such as bedwetting or sucking their thumb. A very common symptom for someone who has experienced or is experiencing trauma would be their engagement of fight, flight, or freeze responses. However, responses to triggers are best thought of as reflexes. They are not deliberate or planned. When children's bodies and brains are overwhelmed by a traumatic memory, they are not able to consider the consequences of their behavior and its effects on others. Oh dear, even showers running away. Traumatic experiences can undermine children's sense of protection and safety and can magnify their concerns about dangers. Ensuring the children's physical safety is critically important to restoring the sense of a protective shield. However, even placing children in physically safe circumstances may not be sufficient to alleviate their fears or restore their disrupted sense of safety and security. Exposure to trauma can make it more difficult for children to distinguish between safe and unsafe situations, possibly leading to significant changes in their own protective and risk-taking behavior. Children who continue to live in dangerous circumstances may have greater difficulty recovering from a traumatic experience. Therefore, the first step to trauma-informed care is to make sure that the child is physically safe. Trauma-informed approaches in caregiving is to understand and develop environments that do not re-traumatize the child. We also want to promote a healthy development of coping skills and mental resilience in the child to help them deal with possible future traumatic experiences and reactions. The essence of resilience is a positive, adaptive response in the face of significant adversity. Resilience results in healthy development because it protects the developing brain and other organs from the disruptions produced by excessive activation of stress response systems, transforming potentially toxic stress into tolerable stress. But how do we instill resilience in our child? There are many stakeholders at play. The community and school factors, peer factors, caregivers, and individual factors of the child. Protective factors buffer the adverse effects of trauma and its stressful aftermath, and promotive factors enhance children's positive adjustment. These factors may include promoting high self-esteem, self-efficacy, and adaptive coping skills. It could also include external factors such as positive attachment with a primary caregiver, possessing a strong social support network, and the presence of reliable adult mentors, and a supportive school and community environment. The presence and strength of promotive and protective factors, both before and after traumatic events, can enhance a child's ability to resist or to recover from the harmful effects of trauma, loss, and other adversities. Thus, as caregivers, it is important to work with the child's environment and creating strong relationships within their school and community. We also want to improve the child's self-esteem and self-regulation skills, as well as their interpersonal skills. So here are some things that caregivers can do. Firstly, It is important for the caregivers to identify trauma triggers and reduce these triggers from your child's environment and help them regulate their responses to it. When your child is behaving in a way that is unexpected and seems irrational or extreme, he or she may be experiencing a trauma trigger. A trigger is some aspect of the traumatic event and it occurs in a completely different situation but reminds the child of the original event. Some examples of triggers can include sound, smell, feelings, places, postures, tone of voice, and people. Children affected by trauma may want to cling on to their caregiver for safety. However, do offer them hugs and pets and physical affection only if your child wants it, as those could possibly be a trigger for them. An unwanted touch could potentially re-trauma them. Don't react to your child's bad behavior. Speak to your child in a calm and assuring voice. Try to use direct, specific, and positive wording for both written and verbal rules and directions. For example, instead of saying, "Will you stop be so noisy?" you can say, "Please talk with your indoor voice." Avoid physical punishment, as this could increase anxiety in your child. And although time out is a very popular choice of discipline, you must also be careful when using that if the child has abandonment issues. Instead, research and try out alternative discipline strategies to manage boundaries without triggering their anxiety. Where possible, you can also offer them choices for the consequences of their behavior. For example, you can say, "That was not nice. Do you want to say sorry and continue playing with Kayla? Or do you want to read a book with me until you have calmed down?" As mentioned in earlier slides, children affected by trauma may regress in behavior to a younger age. So, for example, a child who is 5 years old who themselves might be regressing to an infant and needs to be soothed instead of punished. Remember, don't take bad behavior personally, but instead help your child find ways to express appropriately. When discipline is tricky with a child who faced trauma, it is important to ensure you have a well-established discipline and consequences system. As much as you can, give lots of warm praises. The ratio of praise to criticism should be at least 6:1. Being physically for them is important. But you, as the caregiver, also need to have the capacity to be emotionally available for your child. You will need to address your own trauma, if you have any, and avoid negative coping mechanisms such as alcohol, drugs, and risky behavior. It is okay to admit that you are having a tough time coping too. If you are in a good emotional health, you are also more likely to be able to actively support your child through their trauma. Children often model after adults, and if you have consistently good routines around meals and sleeps, that would also show your child how to take good care of themselves. It is very common for parents to want to relax after a long day of work and wind down by watching television. However, watching television with your child is not the same as spending quality time with them. Make sure that there are fixed times in the day where no devices and technology is taking both your attentions away from each other. For example, this could be during dinner time or an hour before bedtime. Listen to your child. Some children might reenact their trauma, and you can be there to offer support as they are sharing. When you are listening, you have to be fully present, both verbally and non verbally. When you communicate with them, use respectful words and don't try to hide information or evade from their questions. If you can help it, try not to avoid topics because of your own discomfort. By listening to their stories and questions, however difficult, you start building healthy relationships between you and your child. Over time, this can help them feel like their voice is important, and this also helps them with their self esteem. Open conversations also build trust, and this will encourage your child to approach you and confide in you when they are struggling. It is so important to listen. Help your child learn to relax by encouraging them to do slow breathing or say comforting words to soothe themselves. There are many ways for relaxation, such as tactile playing with sand, bubble, water, paint, and other hands on things, and this can be quite soothing for them. Other creative and relaxing activities would include painting, playing with Play Doh, playing with dolls, and listening and moving to music. It is also good to give them age appropriate games to play, such as puzzles or building Lego or playing house. When playing by themselves or with other children, there are often many opportunities for caregivers to teach them and praise them for mastery of skills and socializing. And this would help them to build confidence and self esteem as well. Deep breathing is another good and easy technique to teach your child. One way to teach your child deep breathing is to lie down with them on your backs and ask them to place their hands on their abdomen and pay attention to how it expands as you breathe in and as you breathe out. And practice this for 10 minutes a day could be really helpful for relaxation. Nowadays, there are also mindfulness and yoga classes for parents and children. And if that is something you are interested in, it could help for relaxation. Research has found mindfulness to be a good way to self regulate and build resiliency for teenagers. Lastly, you can create a comfort corner for your child. This corner can be filled with soft blankets and pillows, and it's a safe space for your child to go to if they are feeling stressed, sad, or angry. Be consistent and predictable by developing a regular routine for your meals, playtime, and bedtime. This helps your child feel safe and secure. When they feel safe, their brains don't have to engage in fight or flight response all the time. Prepare your child in advance for changes or new experiences by taking them, showing them pictures and videos, talking to them about the new experiences, and giving them a preview of the new change. For example, if they're starting at a new school, you can show them some pictures of the school, talk to them about what is going to happen at the new school. You can also request to bring your child to the school beforehand and explore the school's surrounding area with them so that they are comfortable and know what to expect. If possible, don't allow young children under 5 years old to watch television unsupervised, especially programming that exposes them to traumatic events such as death and disasters. If you do come across this type of events on the television, actively engage your child and talk to them about what's happening. Last but not least, when needed, a psychologist trained in evidence-based trauma treatment, such as trauma-focused cognitive behavioral therapy, can help children and families cope and move toward recovery. Ask your pediatrician, family physician, or school counselor for a referral. With the help of a mental health professional, your child can learn to manage their symptoms, and you can also support them with lots of patience and persistence. Here are some websites and organizations with lots of informative trauma-related materials. If you are frontline staff working with children with trauma, there are also many additional resources and evidence-based therapy models that can be found on those websites. By equipping yourself with knowledge on this topic, you will also feel more empowered to support your child through this journey. As caregivers, I'm sure you hope your child will recover. But be mindful, recovery does not necessarily mean complete freedom from post-traumatic effects. Like traumatic reactions, recovery may look different for different people, and some children may take longer than other children to find normality again. Recovery is a process of change through which they improve their health and wellness, live a self-directed life, and strive to reach their full potential. Remember, don't be too hard on yourself and seek support through resources and from your social and family circles, and seek professional help. That way, it will be easier to see the light at the end of the tunnel. Thank you, Shao, for appearing in our presentation today.